Forever, I've always said, and it is true, that I respond to every email. And I'd be lying if the volume that I get now is the same as maybe what it was 10, 15 years ago. A lot of times I would even respond to phone calls late at night because it would be able to catch the people on the West Coast. I recently got an email from it was a DM rather, and it was cool for him to say like, "Wow, you're a man of your word." He saw me on Niall's podcast, Transparent podcast. That should give you an idea of the questions that he was asking. Actually, good podcast. I felt that was it was cool to talk about some other things, but great call. Hopefully he gets what he needs. It doesn't always work out that way with the and also as a business person who I do work with people, contrary to maybe what some people might think. I was coached a long time ago. I'm charging more than when what I was charging then. So I'm not going to say the number, but Charlie, if people are going willing to give you this amount of money, who the hell do you think you are to not talk to them on the phone? Like a discovery call. And I didn't like doing it because they didn't, there was nothing I could do. Like my back hurts. What do I do? Like, I don't know. And I found out really that they more so just wanted to know that the person that they were going to give a lot of money to actually was probably not a doofus and that actually had some empathy and took the calls. It always went well. Very good level of closing, if you will. So the doesn't always go well. So a buddy of mine, great friend, always looking out for me in terms of obviously in the profession. So there's things that people look at him, they look to him for solutions. But he's on the fitness side, business side, and copies me on a group text. Please see so and so. They're having terrible back and leg pain. Blah blah blah. I immediately respond. He said, "Hey, I'm working for the next several hours, and I'm on the West Coast, calling back to home. So please, I apologize. Don't take my lack of response as apathy." Called as soon as I could, and I said, "Well, I know a little bit, very brief that there's some back problems through the text message. How can I help?" Well, this is not verbatim, but it was a very stiff tone. I don't know how you can help. I don't even know who the hell you are. I said, okay. And I'm thinking like, ah, yes, I get a freebie here. I can stay on the phone and I can say whatever the fuck I want to this piece of garbage. So that's what happened. I said, well, if you have back pain, there's a number of things that you can do. Very quickly in the conversation, this person reminded me that they were Asian medicine practitioner and well trained in yoga. I'm like, this is gonna be fun. They went on to continue that they went to a physician who recommended surgery, which they said I'm absolutely not doing. I said, okay, well, I'm not sure what to, where to help because if you feel like you've exhausted conservative approach, physical therapy, chiropractic, Asian medicine, all these different things, if you feel like you've gone to a great person, the likely remember I got a freebie on this one. The likelihood that you have gone to see someone excellent sounds like very low, but if you really believe that you've seen great people, well then you might be looking to things that are less conservative. She also mentioned that she refused to get a cortisone shot. Now, a cortisone shot in the spine is something that is useful. That's not the same as epidural, even though they would both be using a steroid in the injection. Steroid injection might be something that's more global, and the epidural is obviously in one very, very specific area that would be trying to minimize inflammation in an attempt to anesthetize the nerve. So the leg pain should go away. Refusing to do both of these things. I said, okay, well, I don't really know then, what to do for you. I think but I didn't give up. I was still, talking, in what if you were listening in, you would probably be laughing. But I said, like, well, I don't know what when you have these types of symptoms. She said that she screams when she gets out of bed. This has been going on for 4 months. Really a lot of problems, and that she's typically able to fix herself. Well, I said, well, a cortisone shot can kind of make you feel human. You deserve the right to feel human. And if we use medications, no, I'm not doing cortisone. It's degenerative. I said, that's completely false, even though it's technically not. I'm talking in a very combative way to this piece of garbage. I said, like, if you get one cortisone shot and it works in terms of kind of allowing you to move on to the next steps of your rehab and recovery, the cortisone shots is brilliant. Now, if you feel great and don't do any changes, it's going to make it look like the cortisone shot didn't work. And if you just get one cortisone shot, the cartilage degeneration, the cartilage wear that is associated with using those types of steroids, is nothing. You need to whatever the price is okay to pay. Sometimes completely adjunct that goes in a complete other direction. That when someone is so arthritic, I'm like, get a cortisone shot whenever you want. You've already paid the deductible. You're not going to wear away any more cartilage because you don't have any. So if the cortisone is this big shop vac for the fluid inflammation that's being generated, no, it is not going to do anything to solve or even understand where this is coming from. There is certainly high value for a diagnostic approach using cortisone, but she refused to do that. I said, well, again, if you're not doing that, I don't really know. Sometimes that is a level that is where you're at, and you need to do this. I have no idea if you need surgery, because that's obviously a very, very temperate topic. The best spine surgeons in the world have the warranty. I didn't say this to her, but this is more of talking about the topic. They can look at your current symptoms and your MRI and be aware that back pain at the highest levels can have a spontaneous remediation. But that doesn't mean they're disallowed or unethical or inappropriate to do some type of procedure at that time, which would also work. You just start to pull thing out of Jenga at the bottom, and you're at this much different level of inherent compromise that if you can treat it without surgery. Of course, and I think the surgeon would agree with that. They just don't have it in their DNA, if you will, to kind of wait it out. But that should also be the patient's approach. But that patient is typically not discarding surgery as an option, like this young lady, absolutely refusing to do this. So when you put all this together, the arrogance of people that if the things that they're passionate about, the things that they're great at, are marginalized, and I think it's very fair to say, as I'm even doing to a degree, marginalizing yoga. Yoga is a fine. I talked about this forever. There's nothing wrong with yoga. It doesn't solve everything. Asian medicine, of course, if it works, it works. If it doesn't work, it doesn't work. And there's probably some level that all of these different things, despite some levels of communication, that chi and energy and chakras are the reasons you believe this is working. There is real science that would suggest it works for other reasons. It doesn't mean don't do it. It doesn't mean it's bad. But not everything works for everybody. And not everything that you love doing or that you love being done for you is always going to be the solution. Of course, there's going to be times where you need surgery. I don't know that this is not, but for this person to then communicate to somebody who is giving their time, that is worth a lot of money, doing it as part of a discovery call. Obviously, they're in a lot of pain, they're wounded, they're going to act crazy, but you cannot discard things. Like to say, I'm not doing that under any circumstances. We're not talking about cocaine or sacrificing wearing goat gear, in Dragnet. Like you're not sacrificing, Connie Swale. Unbelievable. Like it was a ridiculous approach, and her communication was so angry. Now, were they angry at me? No, I don't take this personally. In fact, it's allowing me to maybe, have some good content, perhaps. But my point is we don't get the choice all the time of what method is going to work. And this then takes you into the real clinical message here. When somebody is so good and so passionate, but and unfortunately they think that what they do can somehow solve everything, then this is very, very dangerous, because it cannot. There is no technique or singular approach that can somehow check every single box. That's impossible. Even when it is aligned with the symptoms, that doesn't mean things always work. And the need to kick, the need to refer, the need to confer with other methodologies is obligatory. And sometimes the horse is out of the barn. I mean, to think that it's not, it doesn't make any sense, especially when somebody is empathetically, at least at the onset of this conversation, trying to communicate in a way to help make your life better. To completely reject that, just because a practitioner may have a different view, including one that is legitimately a weaker view. Like this is not an intelligent practitioner. That doesn't mean that that's not going to wind up being your solution. And that's where I think it's very, very important that whenever you choose to work with somebody, that they don't have every answer in their office, in their gym, with their hands, with their needles, or with their tools. What they do have is the ability to think beyond what they're good at, be able lateral the football, let someone else score the touchdown, and hopefully you'll remember that they were the ones that got you to the right person.